Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How you doing today?
Good to see you.
Good to see you too. So today we're asking the question, my kid has a toothache, what do I do? What is the source of this problem? Where do I go? Does he need to see a dentist? Do they not need to see a dentist? And we know that kids, when they are in pain, can express that.
Certainly, children are great patients, so it's not like the crazy movie scenes you see with kids running around. But if you have a son or daughter, I have 3 children. I went through this. Of course, they're grown now. But a lot of times, moms and dads try to keep the kids sedated with their milk bottles, basically.
Yeah.
And that's called milk bottle caries. Milk bottle decay is what it is.
Mm.
And when we see children, if you have that picture up there, that look, that's a young boy. And when kids are running around and energetic and there's nothing, they're moving. But when they're sick, you know it.
You know it.
And these things usually hit in the middle of the night.
And it feels urgent to these kids, and they express that. They're in pain.
Terrified, it hurts, they just want to go to sleep. So oftentimes it's a decayed tooth, baby tooth, and it hits the nerve dies, and you get an infection.
And it hurts.
Most of the time we take the tooth out, talk to mom and dad about maybe some orthodontic retention or retainers. Depending on their age, this can hit between 3 and 12 years old. We're just showing a young boy here. And the other case is that sometimes the roots just dissolve as they're getting older, and the gum is so fibrous it kind of holds it in like a rubber band, and bacteria get underneath it. And
then it becomes infected.
It's like it's like swimming in the kiddie pool. No
it's
one
like
wants
the perfect
to swim
storm,
there, right?
Yeah.
It's a bad soup recipe, so we take that tooth out, same thing, depending on where they are.
And you said that this can really happen because of milk bottle decay.
It could be juices. It could be they have a lot of candy. Fruit is actually a big problem too.
Really?
It's healthy in moderate use.
Yeah.
If you're not brushing following eating, which the 5 or 6 year old is probably not going to. And again, I'm a dentist father. I try to make my children brush when they went to bed. I checked. My wife did.
Yeah.
And certainly sometimes our children had a couple cavities. We took care of them. Now they understand, of course, as a grown.
Yeah, how important it is to brush your teeth. So the lesson here is encourage your kids to brush your teeth. Make sure that you're cleaning those milk bottles, not using the same one for too long, trying to avoid that decay. And if your kid does have a toothache, it's a great idea to get them to the dentist as soon as possible, because it's probably an infection or something that's decaying.
So we always say, before this happens, bring them at age 2. They see mom and dad sitting in the chair. They get used to it. They think it's a fun episode of their life. We check them twice a year, just like the adults. They get their fluoride, just like the adults. If they need sealants, we do that. And sealants reduce cavities by 75 to 80%.
So this is preventable.
Again, that's all we talk about. Dentists, all we fight are gum disease and cavities.
Gum disease and cavities.
And if we don't get to it in a timely fashion, you end up with considerable amount of dental work and, unfortunately, the costs.
Yeah. So avoid those costs, avoid that dental work, avoid that pain. If your kid has a toothache, come and visit Dr. Bilski, and you can learn more. Schedule your appointment for your 2-year-old. And if they are past 2, get them in as soon as possible. Get them in to see the dentist. Yeah, bilskidds.com, and you can schedule your appointment right there online. Thank you so much.